Edo State Governor Godwin Obaseki has blamed the travail of former Deputy President of the Senate, Ike Ekweremadu, on poor medical system in the country. He stated this while addressing the Committee of Chief Medical Directors in the country, who paid him a courtesy visit. Paul Ezenwa reports.
Every year, chief medical directors and other stakeholders converge to meet minds on how to review challenges facing healthcare delivery in the country. This time they are in Edo State and on a visit to Government House to meet with Governor Godwin Obaseki. Top on the discuss is the issue of faith healthcare system. They believe medical tourism is a huge challenge facing the country today. The governor insists that in order to curb medical tourism, Nigerian tertiary hospitals need to advance on its technology to make diagnosis faster.
It was very, very sad.
He explains that only such would have averted the current situation being faced by the former Deputy President of the Senate.
When I read about the conviction of Ekweremadu in the UK, I just, it was very, very sad. That here you have a situation, two Nigerians, a patient, a donor, and I'm almost certain that the person who is going to do the transplant in the UK may also be a Nigerian, leave their country to another person's country to perform what would otherwise be a life-saving operation. And look at where it's ended. Just because we have failed to provide for ourselves.
The spokesperson for the group earlier commended the governor on his developmental strides, especially in the area of healthcare delivery.
We want to thank you for the Edo State Health Insurance Committee, Corporation Commission, which you've established, with emphasis on sustainability. So thank you, because one of the challenges which we are discussing is the fact that most of the patients we see cannot pay their bills. And without a sustainable healthcare financing mechanism, the honest truth is that the healthcare sector would not develop. In most of the industrialized countries, most of the innovations you see are because people pay and can afford, and there's enough money, for people to invest in healthcare. So I think it's a major step in the right direction, and for that we say thank you, sir.
The group also visited the palace of the Oba of Benin, Oba Ewa II. Paul Ezenwa, TVC News, Benin.